down to being with so much pain. The tooth is throbbing, lingering, non-stop, and you feel that it is so hot that you cannot stand it. And this happens when we have either bacteria in here, or it was little by little filtering through your crown, and then it start getting into the nerve, and the nerve start getting so inflamed. It's not dead, it's not infected, the infection is not draining yet, but guess what? This is the indication that you're having an issue with your nerve, which is inside the tooth, remember. So what happened in these situations is when it's so much inflammation and the nerve cannot get out anywhere because these walls that you see on the side are really hard. So we're gonna talk about a friend that I said to her, if you're having this type of pain with the tooth, first she was having pain with cold, hot, it wasn't lingering. She went to a trip, she lectured, and then she called me from Chicago on a Saturday and said, guess what? I'm in a lot of pain and I cannot stop it with anything. I said, you have two options. One, either get drunk, which was a joke, of course she doesn't drink, or take a lot of ibuprofen. Lot meaning I will give you a tip in this episode about what is the meaning of ibuprofen or Advil. Advil is a commercial name, but ibuprofen is the formula that we have, an anti-inflammatory with one Tylenol. One Tylenol that is acetaminophen, can be 325 or 500 milligrams. The combination of these two medications is going to work in the different receptors of the brain, and it's going to stop the pain better than it's only the anti-inflammatory and together the medication. But this is a pharmacy things that you can get. You can take the ibuprofen 400 to 600 milligrams 3 times a day. But in this case, my friend was traveling immediately. She wasn't in a mood of anything, only she was having the ibuprofen and the Tylenol, but still the pain will come back and will come back. And she remembered I was telling her one time that when you drink something cold, the pain can be relieved. And when she came to the office, she has a glass full of ice, and she said, you know what, I know what is the tooth. This is the tooth, because before I didn't know. I said, okay, just sit, let's do the diagnosis. After battling for half an hour that she was using the call all the time, we finally were able to see the patient. And when we see the patient, we start doing the endodontic evaluation, and we did all the testing show in percussion, palpation, everything. The tooth that she was mentioning, that it was this molar that you see here, this big one, that has something black in here, in this area, in this particular area, can simulate she has an infection. But when you have an amount of one crown here, another one, you have to be sure you are doing tooth by tooth, comparing what is the tooth pain in this area and what is the tooth pain. Let's say I tell my patient, if I said, do you have pain with cold in this tooth, in this particular tooth? So I have Amanda next to me, write it down. Yeah, the pain with cold is gone in few seconds. That is not a root canal. I check this tooth, the pain with cold is again, oh my God, it's gone immediately. In this tooth, the pain was relieved. So imagine this. That is why the patient drinking any glass of water with ice will stop the pain, because this is another way to call it. It's an acute inflammation that we used to say irreversible acute pulpitis. This is a very old diagnostic classification with my teacher, Dr. Daniel Silva Herzog. And in this situation, it doesn't matter. The patient wants to know which one is the tooth, how we're gonna relieve the pain. And for you to know that sometimes if nothing is working, try a glass of water in case this tooth is alive, is inflamed, and you can, no drug can stop the pain. Because remember this, the nerve is so inflamed that people want to jump out of the planes. They wanted to kill themselves. The pain is horrible, so don't wait for that. Try the cold when you're having certain amount of pain. We finished the treatment in this patient, and it's right here. And since we are still friends, that day, by the way, she took me for dinner, And since we still are friends, then she immediately realized I did the root canal in the tooth that she needed, which is this one. 23 years later, she's still happy. We still have dinner every week, and we're still friends. If you have any questions, give me a message in our channel in YouTube or Instagram. Thank you.